Hello, my name is Angela Goodridge, and I am one of the instructors for the Nursing Assistant Training Program here at Good Nursing and Medical Training. Today, I am going to be explaining the content for week 1 of our hybrid program, blended program. This program will be taught 2 weeks online, and this third week will be in the classroom, in lab, and the fourth week will continue to have our clinical sessions and 1 day of classroom where the student will complete the final exam. So, as you know, this is a nursing assistant training program, and we will have for week 1, we will have chapter 1 through 5. There are quite a few tabs on here, and you'll find that there is learning objectives and a PowerPoint. There is also an assignment tab, and there is also a test for each chapter. So you'll have 2 weeks to complete this. Hopefully 40 hours of content will be covered, and we look forward to assisting you in learning this information. On the second tab in the classroom, you will find online access to the textbook and to the workbook, but you will have to also have your actual textbook and workbook for you to complete your assignments, and you'll have to take a picture of your assignment and upload that to the assignment tab under each chapter. So let us start by talking about the objectives of each chapter. In chapter 1, it's called The Nursing Assistant in Long-Term Care. In this chapter, you would learn about the various healthcare facilities which the certified nursing assistant or the nursing assistant will work. You would have the PCT, sometimes they're called PCTs, or nursing assistants or nursing aides. So we'll talk about the various healthcare settings. We'll also talk about the long-term care environment, because our course is primarily focusing on long-term care. We will talk about the role of the nursing assistant. As a member of the healthcare team, the nursing assistant plays a very important role, and so we will talk about some of the skills and activities that will be performed by the nursing assistant, especially activities of daily living. We will also talk about professionalism and some of the characteristics of a good nursing assistant. We will talk about the healthcare team and the various members of the healthcare team that will be assisting the patient, and we'll understand that the patient and their families are most important in the care of the patient. So you would learn about the healthcare team, the chain of command, and the organizational structure or the organizational chart of a facility. So we'll also talk about Medicare and Medicaid, the two major pay sources for care in a long-term care environment. We will talk about various policies and procedures and professionalism relating to the role of the nursing assistant. We will also discuss legal and ethical behaviors relating to the patients, especially patients' rights. Patients have many rights, and as caregivers coming into the field, we will teach you about the residents' rights. We will also talk about legal aspects relating to the care of the patient, rights and wrongs. We will talk about various forms of abuse, some of the things that will affect the patient, that will affect the caregiver as well. So we will talk about that, and we'll discuss residents' rights in very detail. We will talk about what's rightful, what's wrong, ethical, legal terms we will discuss. And we will also talk about the MDS. That's a minimum data set where we caregivers, CNAs, and nurses will collect a lot of information relating to the patients. And we will talk about a care plan, how the care plan is developed, and we will talk about how we will put those specific skills in place for the patient to meet the patient's goals. So you would learn that every patient has an individualized care plan. We will talk about accidents and incidents and how to manage that and how to go through that. So we'll talk about the medical record as being a legal record, and also about time and good documentation skills. In terms of the time, we'll talk about military time and standard time. So we'll talk about the various forms of time that you will perhaps work with in your healthcare environments. So that's about chapter 1. In chapter 2, we will talk about the foundations of resident care, understanding the importance of verbal and written communication. Chapter 2 starts with verbal communication, verbal and nonverbal communication. We will learn about the various barriers to communication. We would learn how to communicate with residents with special needs like mental health needs, or visual needs, or hearing impairment. So we'll talk about that. We'll also talk about ways to promote safety and handle non-medical emergencies. We will talk about some of the medical emergencies and how to recognize them and what to do if such situations occur. We will talk about infection prevention. Now, that's the main subject area of chapter 2. Infection prevention, infection control, using standard precautions and using transmission-based precautions. So we'll pay quite a bit of attention to all those foundational skills and information relating to the resident's care. That's chapter 2. In chapter 3, we will talk about the resident, in understanding the resident and all the various needs that the resident may have. And so you will find that the resident has physical needs. We talk about 5 physical needs, basic physical needs. We'll talk about some of their psychosocial or psychological needs, the need to be loved, the need for acceptance, the need for feeling like they belong. Those are some of the psychosocial needs. We'll discuss those. We'll also talk about patients' spiritual needs, patients' cultural needs, patients' sexual needs. So these are all needs of the patients, and we'll talk about those. We will define holistic care, looking at the patient as a whole person, not just the illness, but their mind, their body, and their soul, just the whole, all the aspects relating to that one patient. We will explain independence and why independence and activity is important. We'll teach you to note that independence and activity are ways to help the patient maintain their esteem, and activity helps to promote their health, and a lack of those two can cause a deterioration in the patient. We will talk about culture, because culture is really huge. There are lots of cultural implications, and we want you to know that patients have many cultural differences, and we have to acknowledge those differences. We also will discuss the family and the role of the family and how they connect the patient with the outside world, and how the family will help us to understand what's going on with the patients. They can tell us a good history. If we cannot find that history, the family sometimes will. We'll also discuss human growth and development and some of the developmental disabilities that patients might have, physical or intellectual disabilities. We will describe some of the mental health disorders like depression or schizophrenia, various phobias, various anxieties. We'll talk about that. That's mental health. And mental health is just as important as physical health. And we ought to know that patients just simply need care, just like any physical illness. Patients with mental health illness also need physical care, and taking care of their medications and taking care of them just as well. We would explain about care of patients who are dying. We'd learn that hearing is the last sense to go, and we will learn about hospice and various advanced directives that patients who are dying or perhaps not at that point yet have made, like DNR. You learn about that. And you would also learn about hospice. Sometimes patients make that decision to have hospice at their latter days. And we'll also discuss postmortem care. And that's in chapter 3. In chapter 4, we will talk about the body systems and related conditions. So in chapter 4, there are about 10 different systems that we'll go through, starting with the integumentary system, which is also known as the skin. So we'll talk about the various disorders of the skin and what we as caregivers can do for the patients with these various skin problems. We'll talk about the musculoskeletal system. That's the muscles and the bones and the ligaments. So we'll talk about how these disorders can impact the patient, and we'll identify some of the disorders. And we will also talk about what we as caregivers, nurses, and nursing assistants can do to assist the patients when they experience problems relating to their musculoskeletal system. The next system in chapter 4, it will be the nervous system, and we will talk about the various disorders affecting the nervous system, such as dementia, strokes, Parkinson's, multiple sclerosis. So we'll discuss some of those problems relating to the nervous system and what we as caregivers can do for these patients. The next system that we'll discuss is the circulatory system, and that's the heart, the blood vessels, and the blood. Those are the 3 major components of the circulatory system, also known as the cardiovascular system. And in this system, we will talk about some of the major diseases affecting the clients, such as congested heart failure, hypertension, and some of the blood diseases. And so we will talk about some of the symptoms relating to cardiovascular and what we, the caregivers, can do, the role of the CNA, the role of the nurse in situations like these. The next system would be the respiratory system, where we'll talk about some of the respiratory diseases affecting the elderly, like COPD, emphysema, bronchitis, pneumonia. We'll discuss some of those diseases and the care the caregivers can provide when the patients experience such. The next system after that is the urinary system, where we'll discuss some of the diseases relating to the urinary system, like kidney failure or urinary tract infection, and what we as caregivers can do. What's the role of the CNA? What's the role of the nurse relating to these diseases? The next system after that would be the gastrointestinal system, also known as the digestive system. That's the system that breaks down food, builds it up, and transports it to the cells in the body and eliminate the waste products. Well, again, we will discuss some of the diseases like diarrhea, constipation, GERD, gastric problems relating to the stomach. And so we will talk about some of those, and again, we'll talk about what we as caregivers can do relating to the care of patients with these diseases. The next one is the endocrine system. That's the system that has many hormones and glands, and that system helps to control some of the functions of the body. So we'll discuss some of those diseases and what we as caregivers can do about that. The next one would be the reproductive system. And the reproductive system, we're talking about some of the diseases affecting the reproductive system. You'll think there are not many relating to the elderly, and there are not a whole lot of them, but we have prostate cancer, and sometimes women have vaginitis. And so we as caregivers can take care of those patients, provide care, report findings, and so on and so forth. And that's the reproductive system. And then the last system in this chapter is about the immune system and the lymphatic system. So these again are 2 systems that help with infection and transportation of lymph around the body. And so we will identify two major diseases. I think there are HIV and cancer, and those two diseases we'll talk about and what we as caregivers can do to help patients who experience such. So, again, chapter 4 is about the body systems, identifying the disease processes that will affect the elderly mostly, and then what we as caregivers can do, the role of the caregivers, the role of the nurse, the role of the CNA when patients experience such problems. And then the final chapter for week 1 is chapter 5. Chapter 5 covers confusion, dementia, and Alzheimer's disease. So it's a specific, very specific to the disease of dementia and confusion. And so it starts off by discussing confusion and some of the causes of confusion. And again, what we as caregivers, guidelines that we can follow for patients experiencing such problems. So we'll talk about confusion and delirium. We'll talk about Alzheimer's disease and the various forms of Alzheimer's disease. We will talk about strategies for communication with patients with dementia. And you'll find that in chapter 5 is all about the care of the patient who experiences such experience communication problems, experiencing problems with activities of daily living, experience problems with communication. So what do we do? What interventions do we put in place for these patients? We will talk about steps that we can take if the patient is having problems with taking a shower. What do they do? What do we do? We'll talk about if they're having problems with feeding. What do they do? What do we do to help them? And we will talk about some of their behaviors. They have sundowning behavior. They may want to refuse to eat. They may have wandering. They may have forgetfulness, of course, because that's dementia. And so we as caregivers have special tasks and skills to help facilitate them. And we'll talk about that. And we'll also talk about the various therapies. Various therapies like reminiscent therapy, music therapy, and validation therapy. Those are some of the therapies that we'll put in place to help the patients with dementia. Very interesting. There are so many things that we can do to help the patients with dementia, even taking them to the baby room because they remember when they were parents. So we can take them to the baby room and have them play with a doll or something like that to help them feel better. So that's all about chapter 1 through 5. That's primarily what's talking about. And so you would read your chapter from the books. You would read the PowerPoints. Look at the PowerPoints. They're specific to the chapters. And after that, again, you will complete the assignment. Your assignment will be found in your workbook. And so you will do and complete your workbook assignment. You'll take some pictures of it and you will upload those pictures of your assignments to the assignment tab in your class. And finally, you will do your test. And the instructor will grade your test. As long as you have done well, the score will come up. The instructor will review. If there's cause for remediation, we will do that with you. You cannot take the test right away after that if you're not successful at first. You must reread, you must review, and then you're able to take the test once more. There goes all the content primarily for chapter 1 through 5. Remember, if you have questions, concerns, you're welcome to call us. You're welcome to come into the school. You're welcome to send us an email. Again, my name is Angela Goodrich. I'm delighted to present this content to you. Stay safe, be well, call us when you need us. Thank you.